Good afternoon, everybody. Thank you again, once again, for joining the Holding Health virtual coffee morning, coffee afternoon, in fact, now, but thank you for doing that. We found we had some really positive feedback on the last session that we did a couple of weeks ago. So, and as there's a lot of information about what's happening out there, we were keen that we continue to engage with yourselves and tell you what's going on. So I'm Dr. Masood Nazir. I'm one of the GP partners at Practice, the managing partner at the moment. I'm joined by Dr. Anne Cartmill, who will be covering off a couple of the key items. The plan for this 30-minute session is probably for the first 10 minutes or so, just to go over some key areas of things that we know that you're worried about and you've been contacting us about, and then probably take some questions for the last 20 minutes of that session. I think it's pretty fair to say that there's been a huge amount of changes to our lives in the last few weeks, and quite an impact on the way we were used to living, the way we're used to doing things, either both work-related or even home, and the way we ran things. Not just us, but our families, friends, lots of people. That has had an impact on the way we are doing things at the surgery and as a practice. And you'll have noticed that actually the only appointments we're offering at the moment are appointments where actually you contact us requesting an appointment. We assess that request, and the more information you give us, the more valuable it is. And then based on that request, we make a decision. Either you get information back where it's advice about self-care or things you could do. We organise for a clinician at the practice to contact you or ring you, advise you what to do next, or we organise a video consultation with you, which I think initially people were worried about how we would use video consultations, but they seem to be going really well. Helps us when we're assessing our patients. Sometimes just being able to see somebody, a child who sounded unwell from what we heard, but then you see the child running around and doing things, smiling at you. It gives you a lot of information. And same with when you see the patient you're talking to, you get a lot of insight. The same as if they're in the room with you on many occasions. So again, very useful. Having said that, we do still need to occasionally see patients at the practice, but that is only by invitation only. The critical reason for that is we're doing our best to both protect you, because the advice remains to stay at home unless you really need to go out for anything at all. So we only want patients coming into the practice who absolutely need to, and there's no other way to be able to deal with their condition or assess them. So it'll be by invitation only. I think Dr. Cartmill is going to go into a bit later about how the arrangements have evolved in the last week or so to how we're going to do those assessments. But I am grateful to all of you for helping with that by just not turning up the surgery, contacting us by phone or by the website, putting your queries to us. You're both protecting yourself and your families, but also you're helping us protect our staff at the practice. And those are really important things. We want to keep the service running as normally as we can, and it's not going to be easy. On a daily basis, it's changing. We want to continue looking after you, but we need staff to do that. And so by helping us stick to these rules of only attending when you actually need to, we can actually do that for as long as possible. So two other areas I'm going to cover off, and then I'm going to hand it to Dr. Cartmill to do a few areas. One of the most common things in the last week we were getting requests about is the government issued vulnerable patient list. These are patients who are deemed as being at high risk of or being susceptible to COVID-19. Patients have received a letter based on criteria where they're under specialist care, they've had a solid organ transplant, or they're on immunosuppressant medication that makes them a lot more vulnerable. And as a result, they've been identified, a code has gone into our records, they've also been sent a message. And for our practice at the moment, it's about 300 patients who've been put into that category. There are, of course, other patients who we know may be at high risk, and we're working our way through that. But actually, what we were advised to do by NHS England and other colleagues is to await some central guidance, and that is due to be issued in the next few days. That will have assessed exactly the groups of patients who are deemed to be in that high-risk group. Okay? And that's really important. There's some guidance on this. It's not for us to be able to say, easily that unless the patients, that the patients are high risk, unless they fall into some of those very clear categories. The rationale behind that is those patients on that high risk list will have to have different support available to them. So if the numbers are too large, then it will be very difficult to provide that support to large numbers of patients. So we are having to be very strict and clear on that criteria. A lot of that is out of our hands. So we are basically on the information we've been given, the searches that are sent to us saying these are the patients that are identified. Those patients will need for us to contact them and assess them, initially remotely, but also then decide if they need any further input. There may be that actually we link them into a volunteer service, or make sure the pharmacy can deliver medication to them appropriately, make sure they've got enough medication, make sure if there's any other support they need. So the team at the practice will be making contact with those patients and looking at actually how we can adequately support them. We have had lots of requests in the week saying, I've got this condition, am I on this list? I would say to patients, actually, it's very difficult, apart from the people who've had the letter, or until we get this guidance about exactly who falls into that category, it's very difficult for us to say anybody else is on that list bar what we've been sent. There are patients who are concerned, understandably, and they have people who may have things like asthma, who are saying, well, actually, my employer wants confirmation that I've got asthma. Asthma on its own at its present moment in time doesn't meet the requirements to be a patient at high risk of COVID-19, but actually you may need it for your employers to be able to tell them that actually you may not want to, may not be appropriate for you to work, go into work or work from home, but your employer has asked for evidence of that. Your medication prescription should be able to provide that evidence for most employers. If they insist they want something more, if you do contact us, what we will be able to do is send you a simple email back saying, confirming that you have asthma. It will just be simple. You have asthma and you're on this medication, that's it. There won't be anything at all that says, as a result, you're a high-risk patient. That's not within our gift to be able to do that at all. So it literally is a statement of fact which confirms that you're a patient with asthma, so you can present that to your employers. Ideally, we'd like you to be able to just give them a list of your medications, which will confirm you're asthmatic, and that should be more than adequate. The second thing we're getting a lot of queries about is the referral process. And there has been guidance as things change on a daily basis and we head towards the peak of this epidemic in different areas of the country. We may have to suspend some of the things we were used to doing. So routine referrals, we've been asked to start looking at actually our routine referrals and assess them and see if they're absolutely essential or something that can be deferred or left. What we're planning to do is look at a process with our local hospitals where if it is absolutely essential for a referral to be done, we'll do the referral. So the referral will then get queued at the hospital, and that will mean that you may not hear from the hospital for several weeks or longer while they're all dealing with this pandemic and dealing with the patients who are seriously unwell, because all their staff have to be reassigned to these roles. Again, what we'll do is on a case-by-case basis, we will look at each referral, but I would just emphasise that there will be a long waiting time before you may get seen or assessed at the moment. And so therefore, in some cases, it may be appropriate for us not to do the referral at all, but to see how things are in 3 months or 6 months' time and then reassess things from there. Those are probably the key things I wanted to speak about. I'm going to hand over to Dr. Cartmel, who's going to cover off 4 key areas which I think are important. One is primary care networks and actually how a setup of hubs is going to work and why we're setting these up. B12 injections, we've had a lot of queries about B12 injections. We've had a lot of queries about routine blood tests, and then finally about prescriptions. So there's 4 areas Dr. Cartmel is going to cover off, and then we'll move over to questions. Dr. Cartmel.
Thank you. I'd like to begin by saying that things have moved on significantly from when we held our last coffee morning, and although at that point we were warning you of some of the changes that were due to take place and some of the things that we had put in place to try and make that transition easier for people, it's changed at a rate even faster than we had anticipated, really. So I want to say thank you to all of the patients who have taken on board the fact that things have changed, and we've asked for you to self-care, speak to the pharmacist, get support from individuals other than contacting the surgery as your first port of call. And certainly this has really helped us as we've tried to move to more remote working, and has helped our staff and the doctors manage your requests that have come through. So thank you everyone who's been trying their best to help us by looking after yourselves and helping yourselves. That has been really helpful. To come to the issues that Dr. Nazir raised, when we last spoke at Coffee Morning, we said we were continuing to run our walk-in bloods and would continue to do so. Very quickly, it became apparent that that wasn't possible, and we changed to appointment-only blood tests. And now that is changing again, in that we are now not going to be undertaking any routine blood tests. The reason for this is that we want to try to ensure your safety, but also minimise the numbers of individuals coming in and out of the surgery building, so that we keep it as infection-free and clean as possible for those people who do need to come and be seen in the surgery building. So in terms of blood tests, there are key individuals who do still need to come and have their blood tests, and they will be given appointments. These are individuals who are having their blood monitored because they are on warfarin, so for INR checks. It's also for those individuals who are on what we call high-risk drugs or disease-modifying agents. You know who you are. You're called in regularly every 3 months or so for a blood test. So people on azathioprine, methotrexate, cyclosporin, meclobamide, all of those drugs, and also lithium, you will need to continue to attend for your regular blood tests when you are called. Because it is important that we continue to monitor you to make sure that the prescribing remains safe. So please do attend if you get asked to book an appointment for a blood test. The other blood tests that we will be performing are for those where, having assessed you remotely, either by telephone or video consultation, it is the decision of the clinician and another doctor that the only way forward to continue to treat you safely is to undertake a blood test. In those circumstances, we will be booking a blood test for you. All other blood tests, which are not deemed to be urgent, will not be done at this point in time until we're coming out of the other side of this crisis. So that then brings me on to B12 injections. We've had a lot of queries of people who are used to having regular B12 injections and want to know if we are still doing them. There are some people where their B12 deficiency is because of an underlying problem called pernicious anemia. There are others where really the deficiency is more dietary. What we are advising is that we should only really be doing the B12 injections for those individuals where you are experiencing symptoms and where the risk of coming to the surgery is outweighed by the symptoms that you are experiencing due to the lack of your B12. If you can manage, then at this point in time, it is sensible for you to manage. If you can't, and it is having a significant impact on your well-being, then contact us and we will organise a B12 injection. But we're also looking at all those who have been having B12 injections to see in which individuals it is appropriate for us to supplement your B12 intake in your diet through tablets at this point in time rather than injections, and we will be contacting you with a view to that should you be suitable for a switch to tablets. But in the meantime, if you're expecting a B12 injection and you're concerned and have symptoms, then please get in touch with us and we can do that for you. In terms of prescriptions, thank you to everybody who has been ordering them remotely and signing up for online access. That makes a huge difference, and I would ask those of you who have smartphones and computers, if you haven't done so already and are on regular medication, then please do that. It is a very quick and easy way of ordering your medication and ensuring that we then send it electronically through to the pharmacy for you. For those of you that aren't comfortable with that, we have a post box at the front of the building where you can put your repeat prescription request through the letterbox and therefore minimise any risk to yourself of coming into the surgery. All prescriptions are being sent to a nominated pharmacy, and all you will need to do is go and collect the prescription from your pharmacy. The other thing that we're trying to do for individuals who are on regular repeat medication is, where it's possible, we are trying to switch to repeat dispensing or issue post-dated prescriptions for a 4 to 6 month period, which should mean that you don't need to contact the surgery again for your regular medications until July or September, depending on how comfortable your own doctor is with issuing a prescription over that length of time without touching base and reviewing you and ensuring that things are okay. So that's all the areas that affect us as a
So I was just going to add one thing, Dr. Cartman, about the prescriptions, just because I considered a question on here about the process of how long it takes. And I think the only other thing I would say is about our community pharmacy colleagues and the challenges they have. They equally, some of them, like all of us, are probably struggling with staff sickness, staff shortages, and so therefore there's a bit of a challenge with some of them. So I would say that we're trying to make sure we turn our prescriptions around very quickly, and I know that we've asked our clinicians to do their best to make sure they turn around quickly unless there's a query. Just to allow people who aren't aware of this, there is something called the NHS app, which has been launched, which allows you to change the nomination in your pharmacy. That got launched today. So if your normal pharmacy that you get your EPS prescription to is closed, you can go onto this and change the nomination, and the prescription will go to another pharmacy, and you can get it from there. But I would say that the pharmacies are asking us for patients to bear with them, to give them at least 24 hours for their routines from when it goes from the doctor's surgery to them. In many cases, some of the pharmacies have got a text message reminder service which you can sign up to, which says when your prescription is ready for you to pick up, it's in the bag, ready to collect. And I would just encourage people to consider some of those things, just as it may help you.
The other issue, thank you, Dr. Zig, I remembered, the other issue that in relation to your prescriptions, sometimes your own pharmacy may have run out of a particular medication, and rather than sending you back to the surgery to request a replacement, it is worth speaking to your pharmacist and asking them to contact their other branch surgeries or other local surgeries to see if they have the item in stock, because they should then hopefully be able to get it transferred to them for you. Alternatively, if they can't do that, and they may not be able to do that because of staffing issues, if they can give you a ticket for the prescription, then that will enable you to go to a different pharmacy who may have a different supplier and may well have the medication in stock. Sending a request back to your GP surgery to ask for an item which has already been issued should be a last resort after other things have been tried, and we'd ask you to please help us to help you by encouraging the community pharmacists to explore the options that they have at their disposal and to help you.
Just a sound test, I'm just taking on board the request for me to speak a bit slower, so apologies, I get a bit enthusiastic sometimes, so it's noted, and thank you for pointing that out.
So I'm moving on to the big change now, and in case this is being watched by the other patients of other surgeries in our PCN, I'd like to welcome patients from Northbrook and Swanswell surgeries. You may or may not be aware as a patient population that the three surgeries, Northbrook, Swanswell and ourselves, are joining together as part of a PCN, a primary care network. The big change that is coming next week is that we are going to be working more closely together in terms of delivering patient care. This is to ensure that we maintain a service for you, because we are anticipating that just as large members of the general public are going to be affected by this virus, so it's going to impact on our ability as individual surgeries to deliver the service that we want to the standard that we want. And we believe we will be better able to do that by working together. In terms of your initial contact will be with your own surgery. And For telephone consultations and video consultations, your usual doctors will continue to speak to you on the phone, do video consultations with you, do your prescriptions, all of those services that you are used to and in fact have had to very quickly get used to probably over the last 2 weeks. The change that will be happening from Monday is that we are working together to deliver some services. Maternity services for all 3 surgeries and childhood immunisations will, from Monday, be taking place at the Shirley Road surgery. For those of you unfamiliar with it, if you are coming down Shirley Road from Robin Hood Island, it is on your right just before you reach the island for Alton Boulevard. If you are coming from Acocks Green direction, as you've gone over the island at Alton Boulevard, you come across a couple of zebra crossings and Shirley Road surgery is on your left. So hopefully that will give you some reassurance that it's relatively easy to find. And that is where all maternity services and childhood immunisations will be taking place from now on. In terms of individuals who need to be seen for a face-to-face consultation, this will be happening at the Hall Green Health site for all 3 surgeries. So if your own doctor in your surgery who's working remotely feels that you need to be seen and examined, then that will take place at Hall Green Surgery, which is where we've been running the extended access hub for some time now, so some of you will be familiar with it. For those of you who are not, we're on the Stratford Road as you come down from Robin Hood Island and before you go down the hill into Spark Hill. So for those individuals who do need to be seen for face-to-face assessment, because it is essential for us to be able to manage you safely, you will be given a time to come to Hall Green Health Surgery. You will be asked to wait in the car until you are told through a phone call on your mobile phone to come to the front door. At the moment, we are aiming to have doctors from each surgery based at Hall Green Health in order to conduct those face-to-face examinations for their own patients. You will be greeted at the door by a doctor. Please don't be scared and frightened by the fact that the doctor is in protective equipment. This is for your safety as well as that of the doctor, and it's to try and make sure we minimise risk of any transmission of infection. So you will then be escorted through, the examination will take place, you'll be escorted out, and the doctor will then remove all of the protective equipment, go to a separate area, write up your notes, sort out any prescriptions or anything that needs to happen from there. But your time in the surgery is literally for that clinical examination to be performed. All of understanding what the issues are should have taken place previously in the telephone or video consultation. Just to reassure those individuals who are going to be coming here for their blood tests and B12 injections and suture removal and wound inspection, all of those are also going to be at this site. But for those individuals who are coming for the conditions I just mentioned, they will come through the side door. Now, before you gain entry to the building, you will be, our person manning the door will be checking that you have an appointment, because you can only come in if you already have a pre-arranged appointment, that you don't have any symptoms of respiratory illness, so that's a cough or sneezing or anything like that where there is increased likelihood of infection transmission. And then finally they will be checking that you have a temperature, that you don't have a temperature. As long as all those criteria are met, then you can come into the building by the side door, and that will be allowed for things like your Zoladex injections for patients being treated for prostate cancer, urgent blood tests, necessary B12 injections where it's been clinically agreed it is essential that you have it, wound dressings and suture removal. Anybody who needs a face-to-face assessment because they are unwell, that will be a GP face-to-face assessment, and as I've already said, you'll be expected to wait in your car until you are requested to come to the front door, where you'll be allowed entry by the GP.
Okay. Just on, we've got a couple of questions coming up. So one of the questions on here is what happens if you do not drive and don't have a car. So
we would, again, it would depend on the circumstances for which you wanted to be seen. If it was for blood tests or something that perhaps isn't as urgent as that, if it really is difficult for you to attend, then it may well be that we decide between us in the telephone consultation or with your usual doctor and the telephone consultation that actually it isn't appropriate for you to come. If it is essential that you come to the surgery, then we would hope that you would be able to find a family member or a taxi to take you, even in those circumstances where you have been advised to be shielded. This is for those individuals who, for example, are on high-risk drugs who need to be monitored, but if you need the drugs for safety, then you need them for safety. Some of them we can extend, and this would be a conversation with your doctor to make sure it is essential that you come now rather than at another point in time. If, however, it's been that you are unwell and you need to come, if you really can't come, then we would have to assess whether it was possible to undertake a home visit. Again, a home visit is going to be placing you at risk and is going to be placing the clinician at greater risk. And so those will only be undertaken where it really is absolutely essential. And we would request that wherever possible, people make the journey to get to the surgery for assessment.
And so just to help with that, Anne, our plan, and this is from Chris, our plan is to make sure that when you arrive at the surgery, we're not having you waiting almost a few minutes, straight in, see the clinician, and have your assessment and back out again. Our plan is to make the run really smoothly, and this is why we're asking patients to try our best to stick to the times we've got an allocation, and we will try and do our best. We're conscious of the fact that actually we don't want people standing outside in cold weather and all these things, so we're trying to look and plan for that, but at the same time, the hope is that you will arrive at your allocated time, so please don't arrive early, arrive at your allocated time, which we will be expecting you, get you in, and get you back out again safely. Most importantly, that's what we're aiming to do. There's a question on there from Aaron, I'm just picking that up, that's okay. And again, each individual's things without your medical notes in front of you is very difficult, but just as a general thing, treatment many years ago probably doesn't, and I hope it sounds like you made a really good recovery, and so may not necessarily place you in the high risk group, but if you are unwell and you've got some symptoms, then I would encourage you to go onto the NHS.UK website, which in turn will take you to the one-on-one website and be able to give you some advice. It may end up with you advise you to contact the surgery, which you're more than welcome to do, but they have an algorithm that they work through based on the symptoms you have at the moment, and they will help you work out if you need some help.
There was an earlier question from Dawn McLaren asking, is the surgery open today? I need to chat to someone about my daughter.
So Dawn, the surgery is open, and you have two ways of doing that. You can either phone the surgery, but ideally the other way is if you go to our website and there's a particular thing you want to ask us about your daughter, you can submit information to us. A clinician from our side, a doctor, will assess it, and then we'll arrange for somebody to contact you with that query. I think Chris is saying that he's you can't sit in a taxi until you get a phone call. We're saying in that case, if you arrive at the time of your appointment, hopefully, that you may have to wait through the door a couple of minutes, but that's about it, and then we'll get you in.
I'm sure there are any other questions at this point.
So, like I said, I'm more than happy. I think those are probably the key areas that we wanted to cover off. It is almost 12:30, which is probably the key thing. If I can just finish on a note, which is to say thank you to all our patients for bearing with us. It's very difficult times, very challenging times. We keep being told that we're not anywhere near the peak of this at all, and there are more challenging times than this to come. Your support and understanding is very much valued by all of us at the practice. All the kind wishes and words that you send to us as well are really gratefully received, really help keep the morale up of the staff. So thank you very much for that. Thank you for looking after yourself. Thank you for looking after each other, but also for looking after us, because actually that's the only way I think we're going to get through all this crisis. So if you do have questions, please do send them into us. We are having to change processes very quickly, sometimes within 24 hours. And so it may not be a process you're used to, but if you ask us, we'll happily explain this to you. We do sometimes get people getting very annoyed about a change in process, but please understand that actually some of these things the control is out of our hands. And there's a question just asking us to once more go over the prescription process, if we can, one more time.
Okay. So the prescription process is you make your request. Ideally, if you've signed up for online access, you can make it online, and that's the most straightforward way of requesting it. It goes directly into your doctor's inbox, and they will then sort out a prescription for you. You can sign up for that by going onto our website, and it will take you through the steps that you need to sign up for online access in that way. If you don't have that, then you can take your repeat prescription slip, tick the boxes as you have always done, and drop it into the letterbox at the front of the surgery, where it will then be picked up by a member of our team and processed and dealt with. Once your doctor has seen it, and we're turning around routine and query prescriptions within 48 hours at the moment, because we're fortunate with the manpower to do so, then we're sending it electronically to the pharmacy, and they will then process it and have it ready for you. If they normally deliver, because you're housebound, then I'm sure they are continuing to do that for you. But if there are issues, then raise them with your pharmacist.
And just to add to Dr. Cartmell's point, a lot of the pharmacies are asking to register for text message reminders. So when your prescription has been processed, they'll send you a text message. Please bear with them. They also are challenged with staff sickness and shortages, so they may not be able to turn things around as quickly as they'd like to. So sometimes they need a few hours or a day or so to process everything. But again, they'll be able to advise you on that. I think the text message reminder service is really important, really helpful, because that means when you do attempt to pick up your prescription, it's almost certainly ready. And the final thing that I think Dr. Cartman said earlier, if they haven't got your prescription item there, please ask them to see if any of the branches got it. If any other branch hasn't got it, ask them to give you a small token which you can take to another pharmacy. That's probably a better step than being advised to go back to your GP surgery to get another prescription. That unfortunately isn't good for you, and isn't pretty helpful for anybody at all, having to return back to GP surgery and wait in another queue for a prescription that's already been issued. I'm just looking to make sure any other questions. Thank you again for all the kind words and wishes. Please keep safe, stay well, and thank you for your continued support.
So I'm going to sign off in the way that it seems to be at the moment, which is stay safe. But stay safe actually means do what you are meant to be doing in order to stay safe. If you are meant to be shielding yourself, please continue to shield yourself. If you are not in the highest risk group and don't need to be shielding, then protect yourself, protect others by following the advice of social distancing and self-isolation as appropriate. And that way we will all stay safe and hopefully come through this.
Thank you.